Staphylococcal infections are grape-like clusters of bacteria that are involved in a number of infections in almost every human body system. Often it is transmitted through hand-to-hand contact. It is one of those infections that you get quite easily, unfortunately, in healthcare settings, because they're often transmitted through things like patient care activities. It is airborne transmission. Sometimes it is transmitted, or it's often transmitted in through what seems like benign skin wounds or post-surgical infections. This is a common thing in athletics. Um, I've gotten staph infections quite often through healthcare provider or healthcare settings. One common one used to be my allergist. When I was younger, I'd go to my allergist, and almost invariably I would end up with a staph infection on the side of my nose, and that's often due to things like unsanitary practices or yeah, mostly unsanitary practices. So it's important to pay attention and again, stick to those precautions and those hand washing routines. These are different staph infections. We have talked about things like MRSA already. You do not need to know the different staph infections on this chart, only the ones that we specifically talk about, like MRSA, although we have talked about it already. Just to reiterate what it is, methicillin resistant Staphylococcus aureus, MRSA. It is treatable if it's recognized in its early stages and properly diagnosed. It starts as a small lesion. It's like a pimple or a little mosquito bite, a little bit of an abrasion from a recent injury, etc. But it is what's pretty classic with MRSA is the pain that the person experiences as a result of that small wound is much more severe than it should be given the size of the wound if it were not MRSA. Important in athletics, if an athlete has a confirmed case of MRSA, they cannot engage in contact athletic activity until they are infection free. In athletic or rehab settings, MRSA can spread pretty quickly and pretty easily, spread through things like towels, water bottles, hot pack covers, the Velcro wraps, weights and handheld bars, bombs, the tubs of bombs like lip balm, tape cutting devices, ultrasound heads, rehab equipment, stim pads, gel packs, paraffin baths. All of this equipment that sometimes isn't cleaned as well as it should be, is a breeding ground for MRSA. So again, be mindful. I know many of you go to the gym. You want to make sure that you're at the gym and you're wiping down the equipment and using the antibiotic or antiseptic wipes on the equipment. And don't forget things like the weights or things that you lift or people touch, because MRSA can be spread very easily. Encephalitis is another infectious disease. We have talked about it to some degree, I believe. It is literally an inflammation of the brain that's caused by a viral infection, but it can also be a consequence of things like immunization and vaccines. There can be an infection that happens. The primary encephalitis is a direct invasion of the brain and spinal cord, and then secondary encephalitis is a complication of a viral infection in another part of the body that then enters the brain. Zika virus we heard a lot about this past summer. It's an arborovirus, but it doesn't cause encephalitis. It is related to yellow fever, West Nile fever, and some of the other viruses that we've heard about. It is a specific mosquito that is the carrier of the Zika virus. What happens is it's spread, as it said, by mosquitoes. A pregnant mother can pass it to her baby during pregnancy or at around the time of birth. It can also spread through sexual contact. There have been reports about the virus being spread through blood transfusions. There have been outbreaks. If you remember from last year, there are outbreaks in Africa, Southeast Asia, the Caribbean, Central and South America. Also, there were some cases in the United States as well. Most people who get the Zika virus don't get sick. 1 in 5 people do get the symptoms, and the symptoms often imitate other conditions. They get a fever, they get a rash, they get joint pain, they may get conjunctivitis or pink eye. Now, a lot of those things sound like an upper respiratory infection, maybe some of the other conditions that we talked about. The symptoms are usually mild, and they'll start 2 to 7 days after being bit by an infected mosquito. So, it may be that someone has traveled and come back and doesn't even realize that they were exposed in an area of where the outbreak was. Blood tests can tell whether you have the infection. And one of the things that it causes is microcephaly, which is a small head. It's a birth defect of the brain. And as you can see here, the pictures, so the head is smaller. The brain doesn't quite fit. So as you can imagine, there are significant developmental problems associated with this microcephaly. Centers for Disease Control recommend that pregnant women don't travel outside where the Zika virus might be present. So that one was a serious issue last summer. Hopefully not going to be as serious this year. Viral meningitis is another infectious disease. It's an inflammation of the meninges and the cerebrospinal fluid surrounding the brain and spinal cord. We've kind of already talked about meningitis. It's the most common cause is a virus found in the respiratory secretions and stools of people who are infected. Management of the symptoms is most important. Symptoms can last 7 to 10 days before complete recovery. Bacterial meningitis is the more serious type. It's life-threatening, life-threatening infection of the meninges and the cerebrospinal fluid. Can cause permanent brain damage, hearing loss, learning disabilities, resulting in amputations, kidney failures, etc. And it can be spread through secretions, through the respiratory system in the throat, through coughing, kissing, etc. This is another one that can spread pretty quickly when you have people that are in a contained space. Okay, that was pretty quick. We've talked about a lot of these, so I'm not going to revisit in great detail. So that's it for infectious diseases.